Hey y'all, this is why nursing finally clicked for me. If nursing school feels harder than it should, I need you to hear me out for just a couple of minutes. Stay with me. Because the problem might not be your study habit, it might not be your intelligence, and it definitely might not be because you're bad at test taking. The problem is most nursing students are taught memorizing. Memorize nursing. But nursing school, HESI, ATI, NCLEX, test something completely different. They test how you think. So let me show you what I mean. Okay, a patient comes in with short of breath. What's the answer? You can't answer that, right? Because shortness of breath isn't a diagnosis. Guess what it is, y'all? It's a clue. It can be heart failure, it can be pneumonia, it can be anxiety. It can be even fluid overload. It could be pulmonary edema. The question isn't asking you what you memorize. It's asking what you recognize. Did y'all get that? And that's where most students get stuck. Okay, so because nobody teaches you how to recognize the patterns. Trust me, I know. Because I learned this lesson, y'all, the hard way. I failed my Capstone course because I didn't pass the HESI Exit Exam. I sat through the agonizing ATI remediation and I didn't pass that either. I watched classmates move forward while I stayed behind. And if you ever failed an exam, failed a class, or even felt nursing just wasn't clicking, you know exactly how that feels. I remember thinking, maybe somebody else gets this and I don't. What's going on with my head? Maybe I'm not cut out for this nursing stuff. Maybe I just need to study harder. So guess what I did? I studied more notes, wrote more notes. I created more flashcards, spent money on those flashcards. I watched more videos, more practice questions, and somehow I still felt stuck because I was solving the wrong problem. I didn't need more information. I needed a better way to process the information that I already had. And that changed everything. So instead of asking, what do I need to memorize about this particular disease? I started asking, what does this patient actually look like? What are they feeling? What are their assessment findings? What are their labs doing? What's the priority? What's the immediate risk? What can hurt them first? That's when nursing finally started making sense because I stopped studying isolated facts and started connecting clinical pictures. I started noticing something. So the same patterns showed up over and over and over again. Patients struggling to oxygenate, patients struggling to perfuse, patients retaining fluid, patients losing fluid, patient fighting infections, patient experiencing neurological changes, different diseases, different medications, different exam questions, but they had the same underlying patterns. And once I learned to recognize those patterns, I stopped feeling like every question was like brand new, like I know it, but this seems new to me. That's the foundation of applied nursing intelligence. It's not more memorization, not another study guide, not another color-coded binder you'll never open again, or maybe once or twice. It's about clinical thinking, pattern recognition, clinical judgment. Learning how to see what's the question is really asking. Let me give you a quick example. Let's see. When I was in school, I look at a question and immediately search my brain for facts. Now I look for clues. If I see confusion, low oxygen saturations, restlessness, increased respiratory rate, I'm already thinking oxygenation, right? I'm not searching through hundreds of random facts. I'm recognizing these patterns. And that's exactly how nurses think in real life. The funny thing is, nobody told me this when I started nursing school. Nobody really sat Tish down and said, girl, stop trying to memorize nursing. They just handed me another PowerPoint, another chapter to read, another study guide, and told me to keep going. You got this. So if you're watching this right now, feeling overwhelmed, feeling behind, feeling like no one else understands nursing concepts except you, I want you to hear this. You may not be missing motivation. You may not be missing discipline. You may simply be missing the method. And that's exactly why I created this channel. Every week, we're going to break down clinical patterns, clinical reasoning, prioritization, NCLEX strategies, and the things nursing students wish somebody would have explained sooner. Because nursing isn't about memorizing more, it's about learning how to think. If you're tired of memorizing nursing and ready to start thinking like a nurse, hit that subscribe button. And if you want to go a little bit deeper right now, grab the free training. It's linked below, it's in the bio, and I'll walk you through the exact pattern recognition framework that changed everything for me. I am Tish, and around here, I'm your big sis in nursing. Welcome to Applied Nursing Intelligence, where nursing finally clicks. I'll see you in the next video.